If we talk about the basics of endometriosis, what we need to know is that there's a uterus, and then this uterus has a cavity. Under the influence of ovarian hormones, a lining gets made in the interior of the uterus, so it lines the cavity of the uterus, and during menstruation it gets shed off. If a similar kind of lining it develops elsewhere, then that is called endometriosis. Now what happens is that when the normal menstruation happens, there's an exit route. So the menstruation comes out through the vagina. But when the menstruation happens at other areas, for example, we say it's ovarian endometriosis. So the lining is there, a similar kind of lining is there in the ovary. When the bleeding happens, there's no exit. So there's a swelling which happens in the ovary and the ovarian cysts are formed. And so this is something which is endometriosis. It can happen anywhere else also in the body. There is some literature which says that the coffee intake, alcohol, smoking and exercise, they have an impact, but no, not much concrete evidence. It is seen that it happens under the influence of a hormone called estrogen. So the excess of estrogen, so supposing somebody gets very menarche very earlier on, or it's a very delayed menopause, or the pregnancy does not happen at all. So that way, these are the risk factors. You also asked about the causes, and if we talk of the causes, then there are various theories, and one of them is retrograde menstruation. The other one is that there are certain changes which happen in the peritoneum. The lining is more like the endometrium and less like the peritoneal, and then at times after the surgery, the endometrium or the endometrial tissue, you can say, gets implanted on the surgical sites. So even that can give rise to endometriosis. Pain relief options are many. One can have the normal painkiller. We call them non-steroidal anti-inflammatory painkillers. One can try those. If they work, wonderful. If they do not work, then there is a provision of taking hormonal treatment as well. And at times, the surgery becomes important, and one can get relief once they get the surgery done for this. See, what we need to understand is that this is a condition which can actually give rise to bad pain. Pain can be dysmenorrhea, pain can be during intercourse, pain can be while urination, and it can be while passing motion also, So it is a painful condition, that's one, and it becomes chronic by and by. And the other thing is, despite the treatment, recurrence is known to happen. So keeping everything in mind, it's something very, very important that you should get in touch with your doctor, consult your doctor, follow the instruction. You don't have to suffer, but yes, you have to be visiting the doctor, seeking the advice and following the instructions.